My name is Haley Coffett, and we're going to talk about safety procedures for bloodborne pathogens. As I've already mentioned, my name is Haley Coffett, and my plans include becoming a registered nurse for the trauma unit or the operating room. And today what we're going to discuss is safety standards for bloodborne pathogens. As many of you might not know, a bloodborne pathogen or pathogens are infectious microorganisms present in the blood and can cause disease to humans. These diseases can be HIV, which is known for AIDS, hepatitis B, or hepatitis C. And these standards that I'm talking about today are by OSHA for the bloodborne pathogens. OSHA is known as the Occupational Safety and Health Administration, and it is a set of guidelines designed to protect employees against occupational exposure to bloodborne pathogens. Okay, now what we're going to talk about is OSHA's bloodborne pathogens standard training requirements. And these include epidemiology of transmission and prevention of hepatitis B or HIV, risk to the fetus of HBV or HIV, location and proper use of all protective equipment, proper work practices using universal precautions, meaning of color codes, biohazard samples, and precautions to follow in handling infectious waste, and procedures to follow if a needle stick or any other accident occurs. What I have here is the written exposure control plan required by OSHA. It has several steps, and I'm just going to read them off to you in case you can't see it. It's use of universal precautions, required use of personal protection equipment, standardized housekeeping, watering of contaminated protective clothing, standardized policy on cleaning and disinfection, policy on general waste disposal, labeling procedures, secondary labeling, policy on sterilization, use of sharp containers and disposable systems, standardized hand washing protocol, hepatitis B virus or known as HBV vaccination, and post-exposure evaluation and medical follow-ups. Okay, these are your standard precautions of what you should do almost every single day. And you're going to wash your hands before and after every patient because you don't want to get the pathogens on your hands or become contaminated. You want to wear gloves when touching blood, body fluids, secretions, and any other contaminated items. You want to use care when handling sharps such as needles, scalpels, anything else that you might have in the OR or the trauma unit. You always want to wear a mask or eye protection during procedures that are likely to generate splashes that can cause pathogens to get in your eyes and you become infected. Carefully handle contaminated patient care items, and all these must be used in treatment of all the patients. Okay, so what we're going to talk about now is management of an exposure incident in case like you do get exposed or one of the employees gets exposed. And you want to always document the exposure incident, and you always want to identify and document who's the patient and whose blood or body fluid is within the accident or what's involved. The request that the patient you want to request that the patient has blood testing, and you also want to question that your employee has blood testing just in case they have HPV, HIV, or anything else that can occur. You want to provide medical treatment immediately, and you want to evaluate reported illness after the incident occurs. And this is what you're going to do after all this has happened. You're going to follow up measures for exposed workers. The exposed worker can have medical counseling, HIV test a series of 6 weeks, 12 weeks, and 6 months. They can have the HBV vaccination with immune globulin. And they can also have boosters, and then you want to document it of the incident on OSHA form. This is really important because you always want to know the guidelines for the use of gloves All gloves must be discarded after use. Obviously, you don't want to use contaminated gloves on another patient. You always want to replace the torn or damaged gloves. And you never want to wear jewelry under your gloves because it can damage them, it can cut them, anything, and you can become contaminated with pathogens. You want to always change them frequently. You never want to wear them longer than you have to, and you want to wash your hands after the removal of the gloves and before regloving. Okay, so since we talked about gloves, I'm going to talk about overgloves now. And this is going to be the guidelines for overgloves. They are not acceptable alone on the hand barrier. You must have gloves under them before you're allowed to put them on. They must be worn carefully to avoid contamination during handling contaminated products or from the individual that you're working with, the patient. They are placed before the secondary procedure. They must be placed before the secondary procedure and are removed before the patient treatment is resumed. And you want to always discard your overgloves after every use. And this is going to be your guidelines for the use of protective clothing. The protective clothing must never be worn out of the office or going to or like even walking down the hallway or anything. You always want to wear it in the trauma unit or in the operating room. You never want to take it out. It should be the protective clothing should be changed daily or frequently until it's soiled. If it is infected, it must be changed immediately because you don't want soiled clothing walking around in the trauma unit or the operating room. It must not be worn in staff lounges or where people are getting food or drinking beverages. This is going to be the guidelines for needles and preventing sticks. You never want to recap use needles by a technique where the point of the needle is pointed towards your body because you can stick yourself, become contaminated with pathogens, and then have to go through the guideline process. And you never want to attempt to remove a needle from a disposable type device. And you do not want to bend or break the needles before disposal. And a puncture-resistant sharp disposal container should be located by where the shots are occurring or you're giving blood or anywhere the sharps are located. Here we're going to talk about the guideline for regulated medical waste. You want to develop a medical waste management program. Disposal of waste must always follow federal and state and local regulations. You never want to mess up with those. And you want to ensure that the medical health personnel who handled and dispose of waste are trained appropriately when handling the fluids, the body fluids, the secretions, and other liquid waste. And you want to make sure that you pour the blood, the fluids, secretions, and all the pathogens along with the liquid waste carefully into a drain connected to a sanitary sewer system. That way people can be taken care of and you don't have to worry about it. And OSHA contact information, you can find it at www.osha.gov, or you can reach them at the phone number of 1-800-321-6742. Thank you.